All right, well, let's get started. Other people will come on board as we move forward. So, good morning, everyone. This is Larry Boris. I'm Executive Director of the National Association for Workplace Healthcare. We're pleased to have you join us for today's webinar on how successful centers understand an employer's population and culture. This program will be recorded, and everyone who registered will have copies of the slides and a link to the recording. NAWHC has changed its name. If you weren't aware of that, we were formerly the National Association of Worksite Health Centers, but we've expanded to include a variety of direct contracting opportunities and strategies and such, where the worksite center could be the hub of the wheel and other things can be attached to that or integrated. So we have really a total health, total population health approach. We have continued to expand our clearinghouse of information, so visit our website and our LinkedIn groups when you have opportunities. Upcoming programs after this one, we've got four other sessions that are coming up. We have design implementation of occupational health surveillance programs in September. How Bros Bass Pro Shops is addressing medication of its members, how they save money through there. We're going to have a legal presentation on clinical accessibility in COBRA. And then in November, we're talking about rounding our direct primary care with employee wellness. So hopefully you'll be able to participate. All the programs are free to our members, and we look forward to seeing you at theirs. Well, today I'm very pleased to have Juliana Perry, Executive Director of Strategic Alliances and Operations from Johns Hopkins Medicine, join us to talk about their experiences and her perspective and views relating to how to be a really true partner with an employer by understanding its culture and population. So with that, Juliana, I'll turn it over to you.
Thanks, Larry, and hi, everyone. I'm happy to be here to share a little bit of insights about how to best engage different employers for successful health center implementations. So if any of you were at the Dallas conference, you would have heard me start the presentation in Spanish, kind of to show how, make a point of how you need to know your audience and how I had, something to share. There's an audience ready to listen and interested in what was to be shared, and not knowing the specific needs really made it extremely difficult, almost impossible to get that message across. Next slide. So I then shared the agenda and the goals of the presentation that we'll go through today. So first, I'll tell you just a little bit about Johns Hopkins. We've been around for almost 150 years. Anything from CPR, dialysis, heart transplants, you were pioneered at Hopkins. Most importantly to this conversation, we are the largest employer in Baltimore. We have 63,000 employees. So we need to know how to best care for our employee population the same way that any other large employer does. Next slide. So I am actually very privileged to sit at the intersection of innovation, enterprise, and commercialization at Hopkins. Within Johns Hopkins Solutions, we take the IP, the best of Johns Hopkins. We ensure it's adapted so that it's applicable to industry. And then we go ahead and implement these across the country and in some instances across the world. So from population health analytics software to on-site clinics and cancer advocacy programs and other chronic condition management programs, we bring, again, the best of Hopkins to industry, to the large employer and health plan. In terms of the on-site clinics, it seems to be one of the best kept secrets. Yes, Johns Hopkins does on-site clinics, and we have them across the country in a variety of industries and settings. We have customers that have been with us for 20 plus years. We've been doing this for decades, and we have very high satisfaction and retention scores within our on-site clinics. These are literally Hopkins clinicians that are placed at these customers' clinics to run the health services. Okay, so we are going to now talk about the spectrum of workplace cultures. So I am going to share some real world examples and how in face value they may look like the same type of audience and customer, but how different they really are and how important it is to recognize those differences. So the first customer we're going to look at, we'll call them customer A in the food and agricultural industry. They are in a rural location. They are a multi-generational organization, meaning, you know, typically grandpa works there, dad works there, the kids work there. They're in a very tight-knit community. They don't have access to care. Access is very, very limited where they are. And the language that's predominantly spoken is Spanish. In terms of the work style, it's physically demanding, shift-based. And in terms of the culture, this is a family-owned organization, very traditional, not very healthcare savvy. That's customer A. Now we'll look at customer B. Again, it looks like the same place. It is not. Also in the food and agricultural industry. This customer is in a major city, in an urban setting. They have high turnover, unlike customer A. Their workforce is very, very diverse, multilingual. They have over 15 languages spoken at this location. They also have they have more access to care in terms of locations, but they have the challenges of the long wait times to access some of this care. The work style, like customer A, physically demanding, shift-based, tight schedules. And in terms of the culture, this one actually started out as a family-owned organization, and post-acquisition, it is now a public corporation. Again, multicultural, but they are very tech savvy and open to innovation. This has a little bit of a younger employee demographic. Next. Okay, so putting them side by side, the communication styles are very different. In customer A, they prefer the informal face-to-face communications. So those, hallway conversations with the clinician are key. Where in customer B, because of the language, the amount of different languages to accommodate, they rely mostly on digital signage. That's something that's easier to edit and to have in a variety of languages for easy communications. In terms of the health benefits, on the rural community, they are toughing it out. Unless I'm having a heart attack, literally, I'm not seeing a doctor. Customer B is different. They are open to wellness, they are open to mental health, and oftentimes the employees request some of these features. In terms of how we build trust in the rural customer, we build relationships over time. So again, the visibility of that clinician walking the floors or delivering lunch and learns and other educational opportunities provides with that visibility that helps to build trust over time. In terms of the urban customer, we have the need for quick wins with visible impacts. Like something was hurting, I went to the clinician, he or she gave me something, and I'm suddenly well. That's really what they look for and what they need at that location. The leadership style and communication on the rural company, it's really, really easy and direct, right? Bob is the company owner. You knock on Bob's door, hey, Bob, maybe you should consider doing COVID vaccines alongside the flu vaccines because we have seen, certain trend. Bob's like, all right, let's do it. In customer B, it's extremely hierarchical. There are formal channels. You sometimes have to really struggle getting to, okay, so who is the new interim person or interim executive that we need to speak to now? And we have to constantly introduce ourselves, remind executive leadership that there is a clinic on site, and that, that although there may be other SOPs for this location, it is best to incorporate the clinician as much as possible. So it's very different in terms of getting that buy-in that you need from leadership. And then in terms of the clinic use for this specific customer base, the rural community after hours is key. These are, again, hourly employees. They do not want to spend an hour out of work where they don't have to. They do want the ability to come after work. And it's really also critical to provide access to healthcare to their dependents, again, because there is that limited healthcare in the area. And it's key for them to be proactive with their health as well as their employees. On the customer B in the urban setting, walk-in convenience is really essential. They want to make sure that when they have that quick, immediate need, they could pop in the clinic and that they'll be seen. Not so much the after hours, not so much a need for dependent access, but really the convenient, immediate access to care is key for them. Okay, so on the other spectrum of workplace cultures, we have two real life customers that are in the professional services industry. We'll call this one customer A. It is a global law firm. They have a very, very high pressured expectations. They are required, just so to give an example, they're required to have 2,000 billable hours a year. That's billable hours. And they bill in 6-minute increments. Some of them, in the thousands of dollars an hour. They are executives who prioritize efficiency. Time is money, literally. And they have, again, very high expectations of them. In terms of the decision making, this is very partner approved, executive driven, top down, very engaged. Now, customer B, again, looks like the same sort of folks here. These are customers from a cancer research institute. They are different in terms of their work style. They're very mission driven. They are collaborative in nature. They do intellectual work. They are funded through grants. They are, again, innovation focused, that team-based approach. They have more of an understanding and a need for mental health and wellness support. And in terms of their decision making, it is they manage by committee, very consensus driven. Lots of thought go into making a decision. And again, not good or bad, just different, and the importance of recognizing the difference between the two. So on the customer A, in terms of communication, again, time is money, sharp, concise, formal, get to the point. How do we make this work? How can we get over that? Great. Customer B, however, very conversational, exploratory. They want to really understand the why and the how behind anything we do, which is, again, great to have as part of an employee population. Health beliefs, like some of the customers in the food and agricultural industry, there's no time for that. Again, unless I'm having literally a heart attack, I'm not taking time out to go see a doctor. Where in customer B, they're open to wellness, to mental health, and understanding and knowing all the benefits that provides. They take the time. For the trust building process, the law firm needs that quick turnaround, visible impact, where customer B likes to prioritize relationships over time. So in that setting, for example, they really like the lunch and learns or educational opportunities where we bring Hopkins faculty from various specialties to provide insights. Whereas on the law firm, It may be more about the clinicians going to the executive floor to do the flu shots, as an example, so that it's easy and as convenient as quick as possible. Clinic use preferences, on the customer A law firm, they need everything right there and then. So that access to the clinician, labs if needed, mental health if it's a mental health issue, physical therapy for the musculoskeletal issues, everything is readily available for them in a single place so that they don't have to waste any of their precious time traveling to and from appointments. On the cancer research customer, again, very similar in terms of having the access to the services, but they do prioritize prevention. So any wellness activities, biometric screenings, immunizations, labs, health education, again, they are very keen on. So these are things that help us illustrate how in face value, customers may look exactly the same, maybe in the same industry, the same demographics even, but how different they really are in terms of their cultural differences and corporate preferences. So what we have learned from dealing with a variety of customers over time, and in order to get the incredibly high satisfaction ratings we get, we know that one size does not fit all. Don't assume health priorities, right? You have to ask and observe. Language is not just about translation. It's tone, it's trust, it's delivery. For some customers, emails are the best communication models. For others, they actually like to do Facebook posts because that's how they can engage their employee population who may not have a company email or access to a computer during the work hours, depending on their job. You have to meet them where they are. So we call this like cultural humility. It is key. One size does not fit all. Again, what works in a research institute does not necessarily work at a top law firm. Time sensitivity, building relationships with the key influencers. Who do you need to talk to and when and how? And also that you need to align solutions with their organizational goals. What are they trying to get out of the clinic? Is it, the one great testimonial from a partner, or is it a specific ROI metric? It's key that you understand this so that you can be aligned as to how to best deliver it and working very closely together. And wrapping this up, some actionable takeaways to achieve success. So things that you really have to consider and would benefit from. So the sales to implementation handoff is key. We have to make sure we understand not just the shared success, but also any pain points and any lessons learned from prior experiences. I have witnessed instances where, someone says, okay, we're ready to deliver on this diabetes management program. Great. What we need is your roster of employee emails to send them the invitation to get started, for example. And the customer would say, our employees don't have company email. Like this, they're in a chicken farm, right? Poultry farm, for example. And is your program also available in Spanish and Creole? Because most of our population speaks that. So you have to make sure that you really understand what was offered and promised during the sales stage, and that it's carried through to the implementation process. The customer kickoff meeting is, again, key. Sometimes it feels redundant, but it is not. It's really, really important to understand, again, what they are looking for. What is their employee culture like beyond the demographics? what works for them. Do they prefer digital communications? Is a postcard to, the head of household the best way to get that employee into the clinic? What works best for them? And again, confirming with this separate group the top priorities and definitions of success, which is key because at the sales process, you're often working with an executive leadership. It could be a CFO, right? Where in the kickoff calls, you're working with those operational folks who this may be the first time they're hearing about the clinic, and they may not understand that what the CFO's intent was. So making sure that you share those goals and you translate it into what it means for them is very, very important. Lastly, in the operational side, you want to make sure that you have a key internal champion. This needs to be a shared effort. You need to be a partner and go beyond being a vendor. They need to support you. They need to own the success of the clinic, and they need to be able to help you with the influence to any decisions or changes that need to happen at that clinic for it to be successful. It's also important to foster transparency, over communicate. So after you have a call with your key stakeholders, document it, send meeting notes, specify, okay, as we spoke about today, this is what we want to achieve, and this is who needs to do what by when. And so be really specific about that so that you have that trail to refer back to if things go off track. And then last but not least, the clinician involvement is extremely important. We could not have the levels of satisfaction we do with clinicians who were not engaged or that turned over. Most of our clinicians, we have a 10+ year retention rate. We have clinicians, so there's a clinician that opened one of our clinics in for a large beverage manufacturer, and they opened the clinic 22 years ago. That same clinician leads that center to this day. So it's key in knowing the culture and not just clinically. So we ensure that the clinicians are a clinical fit, but then we also involve the customer in the hiring process to ensure that they are a cultural fit for the organization as well. So them being a known entity, knowing all of the benefits, fostering relationships with the workers' comp team, the safety team, HR teams, and really being at the core of the delivery of healthcare in that organization is extremely key. All right, so we would open it up. Larry, if anyone has questions, how would you like to handle this?
So what I like to do, I'm going to go around the table and ask each individual for any comments or questions. We start out with, so let's start with CJ Minette. CJ, comments or questions? Things you want to share? CJ, go ahead. You take yourself off mute. Okay. Sue Goodling, Sue, any comments or questions? Sue, go ahead. Can't hear you.
Sorry, I can't get the,
That works.
There you
Okay.
go.
Go. Yeah,
Oh,
we got you
okay.
now.
Honestly, thank you for the presentation. I thought it was really interesting, good perspective, and I liked seeing the comparison and just the different entities that you serve. But no specific questions, just always good reminders on how critical, taking every aspect of culture is and when, determining the right fit for each client. So thank you.
Great, thank you. Susmita, comments or questions? Susmita, take yourself off mute. Okay, and Tracy, comments or questions? Everybody's shy today. I can see that.
I don't have any at this time, thank you.
Okay. Let me ask you, Juliana, something that you said toward the end about making sure that the provider is a good match with the employer. We always tell employers that they should ask for the ability to interview any of the clinical providers, even the medical assistants, etc. Would be possible to do that. And
Right.
so the other thing I was wondering is, do you profile the providers before they're put in this kind of practice environment? Because they may have to go outside of the four walls. They may have to do things that are not typical in a practice. Do you train the providers in any way or interview them to see their comfort level?
Absolutely, Larry. So not only do we allow for the customers to be part of the interview or the recruiting process, it is an expectation because we understand how key that is. And then in terms of identifying that right cultural and clinical and cultural fit, our team is adept at finding clinicians that have the required not just clinical competency, but level of confidence to do what's needed at a specific location. So again, it could be taking flu shots to the satellite launch pad, or it could be, walking the floor and assisting someone in one of the production lines. It is key, and we provide the training necessary, whether they are occupational health in nature or primary care, or if it's a combined in a setting.
Great, thank you. Susmita, I saw you raise your hand. Comments or questions?
Yes, thank you, Larry. Sorry, I couldn't get myself off mute quickly enough, so apologize. Between
Please.
Teams and Zoom and everything, it's always a challenge. Thank you. I thought that the presentation was so great because oftentimes I think as clinicians and public health advocates, we create programs without really figuring out how to connect with the patient base that the program will be applicable to. So I think that that's such a key component of any program that we design. Just a quick question. Are there questions, or how do you probe to figure out the culture of the employer group that you're working with and what might resonate and what might not? And do you have any tips for how to gain that insight?
Sure. So we have a questionnaire that we go through, and we identify all sorts of things from their literacy level to the gender, age, and other demographic profiles, the preferred communication methods, their engagement success, what's worked with them before, and why, and what's a similar program that has been underutilized and why. We ask about their engagement challenges overall, and then also their culture of health, which is extremely important. So what are the HR team's goals for the next year? What are their perceived biggest employee health needs? And can we support or collaborate to have positive outcomes in any of these? So it really is the over communication and asking a variety of items.
Thank you.
Sure.
Thanks very much. One last question I've got, Juliana, before we go. Some employers start out with Occ Health and then want to expand to primary care and vice versa. Do you find that you need to bring in different types of providers, or do you try to change the Occ Health providers on primary care and train the primary care people to deal with Occ Health issues?
Thanks, Larry. Yes, it is very common, especially on our book of business, where we are asked to come in and start with Occ Health, and quickly, once we get the operations going, we realize efficiencies that allow us to provide other sorts of care. In our business model, we do not bill additionally for the additional type of services. So our customers are happy for us to accommodate a broader scope as time allows. So we provide the necessary training for the clinicians, or we identify clinicians who are trained and have experience in both areas. But again, that's one of the crucial benefits at Hopkins. We have lots of training opportunities and continuing education. The clinicians are always expected to evolve and learn more about the latest trends and the latest research and science.
Great. Thank you very much. Again, I want to thank everyone who participated today. We will get copies of the slides and recording to you. And Gianna Perry, thanks so much for your time and your expertise in sharing. It's always a pleasure to have you at the NAWIC program. Everyone, stay cool. Have a good rest of the summer. Bye-bye.
Thanks, Larry. Bye.